jugular venous pressure or JVP is measured to estimate the pressure in the right atrium. So here in this diagram you can see this is a superior vena cava. It drains into the right atrium, and here are the right and left brachiocephalic veins. So here you can see a right internal jugular vein, and this vein is preferred to measure the JVP because you can see that it's in the straight line with the superior vena cava, while the left side veins are at an angle to the superior vena cava, so we prefer the right internal jugular vein. If we cannot see the pulsations in the right internal jugular vein, we may see them in right external jugular vein. So in this diagram you can see that right internal external jugular vein, and we will ask the patient to tilt the head to the one side, and this will give us the this will accentuate the two heads of sternocleidomastoid, and between them we can feel the we can feel the carotid artery medially and see the pulsations of internal jugular vein. Now moving on to this diagram, here you can see, suppose you see the pulsations here at this point, then you will take a ruler perpendicular to this and place it on the sternal angle, which is also known as the angle of Louis, and whatever height comes we will add plus 5 centimeter to it, because the right atrium is 5 centimeter below the sternal angle. So the normal JVP is 5 to 8 centimeter H2O, and we know that medial to the jugular vein is the carotid artery. So how to differentiate the pulse of jugular vein from the carotid artery pulse? So here are some points. So we know that JVP is more of a visible thing rather than a thing to palpate, because if you will palpate, you will occlude it, while when you will palpate the carotid artery, you will still feel the pulsations beneath your fingers. So we will always see the internal jugular vein palpations, and we will always palpate the carotid artery. So we know the location, and remember this very important point, that with inspiration the JVP drops, the pressure in the JVP drops. And this is a very important point, because in subsequent videos we are going to discuss about Kussmaul's sign, and we will discuss why that happens. But here remember that normally pressure in the JVP should fall with inspiration. And remember that that JVP is a biphasic waveform, that you will see two positive waves in it, while the carotid artery pulse is a single wave. And when you will make the patient erect and in sitting position, then the JVP will drop. Suppose earlier the JVP was seen at this point, now it will be seen a little bit lower. So coming on to the waves of JVP, we will simultaneously draw the ECG and heart sounds with it. So first, this is the phase of atrial systole, and we know that when atria contracts, here is the internal jugular vein, and when the atria will contract, it will increase the pressure in the internal jugular vein also due to back pressure. So the pressure in internal jugular vein also increases due to the contraction of atria. So this is atrial systole, and so this will give us a wave known as A wave of the JVP. And we know from our ECG knowledge that this is the P wave of ECG, this is the QRS complex, and this is the T wave. And we know that T waves is due to the atrial depolarization. So I'll draw ECG here simultaneously. So this is the P wave of ECG, this is the A wave of JVP. Now moving on next, now the ventricles will go into depolarization, and we know that depolarization of ventricles will cause what is known as the QRS complex in the ECG. And when the ventricles will contract, what will happen is the mitral and tricuspid valve will close, and when they will close, the tricuspid valve will bulge into the atrium. So this bulge will cause the pressure in the JVP to rise, and this small rise in pressure is known as our C wave. So let's draw this. So this is our QRS complex and this will be our C wave. And yes, we know that when mitral and tricuspid valve close, the sound we hear is known as the S1. So here we will hear the S1. Moving on further, this is the stage of isovolumetric contraction. Further, what happens is that the ventricles are still in the phase of contraction and the blood is going out in the ventricles, going out to the aorta and pulmonic veins. Meanwhile, and these valves have opened. So the opening of these valves make a physiological sound which is known as the ejection click. So here we are going to hear the ejection click. And meanwhile, what's happening in the atrium is that atrium is getting filled with blood and the blood is coming from the superior and inferior vena cava. So all the volume of the superior and inferior vena cava is being emptied into the atrium. So in a way, the superior vena cava is giving all its load to the atrium. So there is a decrease in pressure in the internal jugular vein and this will cause a descent known as X descent. Because due to the filling of the atria will relax and relaxation will decrease the pressure in internal jugular vein. So this will give us what is known as the X descent. And we know that when the heart, after the ventricle systole, the ventricles will go into state of repolarization. So the repolarization will give us a T wave. So let's draw a T wave here because the ventricles will now repolarize. And now what will happen is that these valves will close. The closure of these valves will make a sound. Aortic and pulmonic valve closure will make a sound known as S2. So this is the point at which we will hear S2. So now what is happening in the atrium meanwhile? The atrium was getting filled with blood here. Now, due to the filling of blood, there is so much blood in the atrium that there is so much pressure in the atrium that there is back pressure, and due to which we get a positive wave, which is known as the V wave, because of the volume overload in the atria. So remember, due to volume overload in the atria, there is a back pressure which will give us a V wave. So let's draw V wave here. This is the V wave. And also what happens is because the pressure in the atria is already very much, and now this pressure will open these valves. These valves are mitral and tricuspid valve, and the opening of these valves will give us a sound which is known as the opening snap. And when these valves will open, the blood will suddenly gush from the atria to the ventricles, releasing the pressure in the right atrium. So there will be a sudden release in pressure which will cause a descent. This descent is known as the Y wave. So this is the Y wave. So this was our QRS complex. This is a T wave, and this here is the phase of isovolumetric contraction, and this point is the stage of ventricular systole. And between S2 and opening snap, we know is the period of isovolumetric relaxation, while this point is the period of ventricle diastole. So let me just recap it once more. So the A wave was due to atrial systole. So remember, A for A, atrial systole, and the C wave was due to because the cusp of tricuspid valve is now bulging into the atrium. So it will give us a small elevation which is known as the C wave. So C wave is due to cusp bulging into right atrium. So remember, C for C, A for A, and now the X descent. Why the X descent? Because the all of the volume of the superior vena cava is now coming into the atrium, which will cause atria to relax. So atria will relax. So X for X. Atria relaxation will cause X descent. And why we will get V wave? We will get V wave because of the volume. Because the right ventricle is now voluminous, and due to this volume, the pressure increases and will give us a positive wave known as V wave. So volume. V for V. And now the last is Y descent. And Y descent comes because the right atrium has emptied itself into the ventricles, causing a downfall of pressure. So emptying, right atrial emptying. So Y for Y. So I hope you got this. Thank you so much. That's it.